Emergencies in life are real, inevitable, and unanticipated. During emergencies, we do not have the luxury of time and may be compelled to make life-saving decisions in a matter of seconds. The only way to positively influence the outcome in these situations is to be systematically trained and be prepared to make informed and appropriate decisions. It may be ideal to observe and acquire skills while dealing with real-life emergencies, but it is impractical and inappropriate to teach or learn while saving lives. How then do we provide an environment that is real or as close to it to acquire these skills? A high-tech simulated mannequin, SimMan, provides answer to this dilemma.
I can't breathe and my chest hurts.
SimMan can breathe, talk, bleed, cough, and cry. His skin can be cut with scalpels, lungs inflated and ventilated, and veins cannulated and injected with medications. SimMan is a unique patient simulator that offers the twin advantage of realistic anatomy and clinical functionality. This sophisticated equipment can make a patient scenario suddenly more challenging by creating an unexpected complication, such as a loss of pulse, an absence of heartbeat, or a sudden difficulty while managing the airway. In addition, the software directs the simulated patient to realistically react to the student's interventions. The computer program also records data and provides objective feedback to participants, enriching their learning experience. The University of Pittsburgh pioneered this wiser solution by creating the Peter M. Winter Institute for Simulation Education and Research, the world's largest center for simulation-based training in acute care. Learning from the rich legacy of the University of Pittsburgh, returning alumni Dr. N. Ramakrishnan, Dr. Ramesh Venkatraman, and their colleagues were instrumental in bringing SimMan to India for the first time. Thus, a pioneering world-class simulation training center, Tact Academy for clinical training, was started. This is the first home in India for a high-tech, real-life mannequin.
The usual thinking of see one, do one and teach one does not hold good for crisis situations. However, simulation has been shown to improve self-perceived confidence of trainees' particular skills. It's not old either. Confucius said, I read, I forget, I see, I remember, but I do and I understand.
I must admit, it bothered me when I was first told I was unconsciously incompetent and that my real performance was much worse than what I perceived to do so. It all changed when the TACT faculty held my hand and took me through a series of scenarios. I started changing from being unconsciously incompetent to becoming unconsciously competent. It was a great, relaxed and fun way to learn.
Educational programs at TACT are enriched by interactive sessions by leading faculty, small group skill stations, and self-directed learning in a state-of-the-art e-learning station with interactive software.
Our courses in TACT are not just for those in training, because it's truly a lifelong learning process in the field of medicine. And continuing education is a requirement for all doctors, nurses and paramedical professionals. We believe in TACT that all healthcare professionals should have access to courses that are comprehensive, interactive and evidence-based. But it's not just enough to acquire the clinical knowledge and skills, because we need more skills to manage a patient, like critical thinking skills, crisis management skills, a team approach and communication skills, and that's what we teach at TACT. And it's truly a value addition to the clinician who now learns to think outside the box.
Training at TACT would better equip every healthcare professional and make them more competent and confident to deal with emergency situations. Everyone's hope in an emergency situation is to have the immediate availability of trained medical personnel. But statistically, over 80% of emergencies do not happen in hospitals. Most of the times, critical situations happen in places like airports, railway stations, factories, or malls, and non-medical persons are forced to deal with these emergencies. So, It is important to increase the effectiveness of healthcare education for one and all. TACT is committed to increasing the awareness in the community on life-saving skills and offers corporate and public health education programs that can be customized to everyone's needs, truly in keeping with the mission of training lives to save lives.
Training lives to save lives.